Hello everyone, this is a presentation about medial epicondylitis, which we'll talk about further a little bit more, but it's overuse injury that happens in the elbow. So this PowerPoint is just to help you guys resource to learn more about this injury. Before we get started, let me introduce myself. My name is Melissa Erickson. I am a licensed and certified athletic trainer, and right now I'm actually at Indiana State University getting my doctorate athletic training degree. Also, I'm a graduate assistant at Indiana State University with baseball, so I'm their athletic trainer for the baseball team. First, before we get really started to what the injury is, I'm going to describe what an athletic trainer is. So basically, what an athletic trainer is that they are healthcare providers for people who are physically active. So physically active, that's just sport, even though that's what most of us recognize with, but it's for all ages with any sport. But we also help with people who have these physical demanding jobs. For instance, like dancers, we help with circus delight, so performing arts, the military, as well as the industrial setting is starting to bump up soon. So it's that deals with being physically active. So as you might know from like professional sports where you see us the most, we don't just tape ankles or give out waters. That's some of like the things that people think we just do, but we have way more stuff that we can do. We can prevent injuries, which means figure out how you cannot get them based on what deficits you have or something that we can make you get stronger so the injury doesn't have to occur. As well as equipment fittings too to make sure that you're protected from any outside forces that are coming your way. We also evaluate injuries. Now, when we say injuries, it can be where our main focus is like bones and muscles. So that's what primarily gets injured when you're physically active. However, we're also trained to identify skin conditions as well as anything to deal with the organs in the human body. And we will just refer out to the proper person to take care of you. We also provide treatment and rehabilitation exercise to injuries so you can get back to what you do with that you that you love to do. So our goal is basically to give you the whole comprehensive care from beginning the time you're injured to when you get back to what you wanted to do. So another thing before we get started is that this is for educational purposes only, so it's just to help you get a better sense of what this injury is, and if you feel like you have this injury, then you should seek medical attention, which we'll talk about later in the treatment section of this PowerPoint. So first, what is medial epicondylitis? That's a pretty big word. So let's break it down so you guys can know what each of that part means so we can further discuss the injury. So medial, in the medical community, medial means towards the center of the body. So this is my elbow. I hope you guys can see it. And so your pinky side, that is considered the medial side of your arm. So in your epicondylitis, which is basically a fancy word for inflammation or irritation of the tendon and tearing and shearing of the muscles that attach to the elbow. So for medial epicondylitis, you have muscles from the wrist that help flex the wrist and move it towards you, and they attach right up here. And and that's where it's usually attached at. And so as you can see on this picture, this is what a healthy tendon looks like. But as you overuse and overwork it, you can have these micro tears, and if you don't take care of it properly, you can have these tears, and that might be dealing with the inflammation that's present in the tendon as well as any soreness or pain. So that's what medial epicondylitis is. It usually occurs right around here, and it's the muscles that help flex the wrist, so up like this, and also do this motion, so putting your palm down. So that's the muscles that connect to right here. Just a little anatomy lesson for you. So how does this happen? It's usually an overuse injury. What that means is that you keep on doing an activity over and over again, so you throw, or you keep on pumping your wrist like this. With that being said, it's an overuse, so you do it multiple times, so there's little tears that happen in the muscle when you overwork it. That just builds up over time, and at one point there's a possibility of your getting injured. So this means that repetitive stresses on the elbow or the wrist. So repetitive that happen occur to this. So this can be, for instance, like you grip and you pull up like this, so towards you. That can cause irritation on your excuse me, over here, wrong side, on your elbow. as well as doing this motion as well. So if you like turn a knob constantly or a screwdriver, that can have pain over here on this or when you throw. So this picture right here, you can have a force that stretches out the joint right there and can cause you put a lot of stress and force onto that area of site that muscles right here. Throw, you kind of just like you flex your wrist, but then you also subject your elbow to those forces that could potentially cause those damages to that musculature. So am I at risk? So basically the risk factors for this is jobs, again, with those forearm motions that we were talking about, the wrist and this. And this is called pronation. So when you're putting your wrist up and down and grip. So jobs that have that aspect are at risk. So plumbing is an example, meat cutting, carpentry, or anything that's operating tools that vibrate for greater than 2 hours a day. Those people are at risk as well. However, you're just like, I don't do any of those jobs and I'm more active. Well, there's these sports that can also do it as well. And these are a lot of overhead sports that do a lot of throwing and wrist and forearm movement. So your tennis, baseball, golf, racquetball, archery because you're holding back and you're gripping it, as well as weightlifting because of the concept that you're doing, and you're also putting those wrists towards you as well. For age, it's any age is at risk, but you're more at risk between 40 to 50 years old, as well as, and also I didn't put it on here, but gender, there's really no studies out there or more information that's saying gender is an issue, so anyone is really at risk when it comes to gender. So how do I know if I have this injury, medial epicondylitis? So the injuries, the signs and symptoms that you would have is swelling, or you notice like a buildup of fluid kind of around where this diagram is pointing. So that's kind of where we point at the pinky side towards your elbow and that bone that comes out, or a little bit below. There's like swelling or warmth on the inner elbow, so that's a sign. Another sign is that you can have pain there as well when you're at rest, so when you're not doing anything, but especially when you're putting your wrist up in flexion, you're grabbing something, that could also help it. That can also irritate it as well. Or if you experience weakness in the wrist. Those are kind of the signs and symptoms, and if you do any of those activities that we discussed before, that may mean that you have this injury. So what is the treatment? For overuse injuries, the best way to get rid of an overuse injury is limit the amount of activity or do not participate in it that's causing it pain. This will allow your body to heal and allow it to recover from these types of activities. However, sometimes that is not the case. We got to keep on going with our lives, especially if it's your job. So what you can do maybe afterwards, or if you can limit the activity, is you can apply ice on your inner elbow for 20 minutes, at least 3 times, at most 3 times a day, and just make sure towel right there. So you just apply like a bag of ice with a Ziploc bag, put it on there for 20 minutes. That will help with the pain and this inflammation or irritation that we're talking about. Also, you can take some medicine. Advil, or leave medication can help with the pain and inflammation as well, but make sure you see your doctor to make sure that you're able to take those medicines, as well as just follow the instructions that are on the bottle. Something that you can also do is you can also purchase a forearm brace, and what that does is that you would attach it right around here, around your forearm, and what that does is that it puts a force on the other part of the body instead of at your elbow. So when you're doing those motions, it kind of alleviates the stretching and the pulling and the irritation that happens on the bones. That's a quick fix that you can find at a sports store or even Walmart or Walgreens. You can also do some wrist stretches and strengthening exercises to kind of just warm things up a little bit more before activity. So you can do wrist flexion like this, extension, but you can just stretch out like so. That helps stretch out the leg, like the muscles and everything, and you just hold it like that. 30 seconds, do that 3 times, and then you should be good to go. If you really want to get adventurous and do some exercises, you can these are some simple exercises you can do at home. So you can just do moving your wrist around, this way and then this way as well. So palm up to palm down, that can help. And you can do that with like a can of food or a water bottle or a soda, like just something that's kind of a little bit more weight to help strengthen the musculature that's around there. That will help with it too, so it can prevent it from happening again. Um, that's really the big thing to do, is just keep stretching it and just take that can like shown like right here and just do 3 sets of 10 twice a day, 5 times a week, and that could help the healing process more along. So again, this is just something, this is a injury, so it will take time to heal. It won't be like overnight like that and it's done. It will take weeks to months for it to heal, for a normal injury like this to heal. So don't be stubborn if it's like, I did this for 3 days and it's not working. You should feel a little bit relief as it goes on, but it's not going to go away entirely in a couple days. If you do feel like your pain or any symptoms are getting worse, or that you feel that this is just, it's interfering with your life, feel like, I have these symptoms, go see a doctor. You can always see your primary care physician if that's the best for you. However, if you want to go to an orthopedic doctor, you can do that. That deals with bones and muscles, and that's a great person to go to for this type of injury. However, some of them, you just got to make sure with that that doctor's office, that you don't need a referral from your primary care physician to go there. So that's really all I have for you about tonsillitis, and I hope that you guys learned more about this injury and what you could do if you have it. But usually if this treatment works, or what you do, you will get some relief. But again, I'm not saying you should not go to a doctor, but you should probably go to the doctor to fix it out. But this is just some more information, just in case if you want to see if you have this, or just really just want to know. So again, I'm a doctor in athletic training state, and I just want to thank you for your time.